So
Hello and good morning, everyone. Welcome to our webinar of AI in healthcare industry. I hope everyone has joined, and I would like to bring everyone on the table. So, all who has joined, could you please just type your company name and where you are from which country you are from? So we have people joined from LinkedIn, from YouTube. So everyone, could you please comment about your name, your company name, and for your country name? Okay, we have people joining from different regions of the world. We have attendees and viewers from India, from Africa, from Nigeria. We have people from Egypt. So let's wait for a few minutes while everyone joins, and then we'll begin the webinar. Okay, we have Abdel Rahman Sameh from Egypt. Hi, welcome, Abdel Rahman. We have Saurav and Bhagirat from India. We have Zainab Khalid from Egypt. So this is wonderful. We have people from all across the world and from region. We have Russia from Lebanon. So a very good morning and a very good afternoon from everyone who has joined from the different parts of the world. I highly appreciate everyone's time for joining this webinar. Okay, we have Adil from Pakistan. Also, we have experts from the South Africa as well. Thank you very much, everyone, for taking the time out today to join our webinar. It will be a great experience for all of us to learn about the healthcare industry and about the healthcare plans. Okay, thank you very much. I hope everyone has joined, and we might have few more people joining in a bit. Okay, we have Beatrice from Tanzania. So thank you very much, everyone, once again, and we hope you all learn how to increase patient experience in today's session. I'm your host and speaker for the day, Vasant Gohil. I'm the regional head and the business development manager from HoduSoft. I manage the Southern and West Africa region. So once again, it's my pleasure to discuss about this wonderful topic, the future of patient experience. I hope we all are here from the different industry, but this is something which is really important to all of us as in person, like whether I'm working in IT industry or healthcare industry, automobile, or any other industry you're working in. This is something we all can relate to. That is healthcare. This is what is very important for all of us at the end of the day. So we are going to discuss something which is really important, that is the healthcare industry, and how as a patient we can enhance the experience for the patient in future. We have people also joining from the Saudi Arabia. Okay, so we will cover in today's session like what are the different types of healthcare plans, what are the challenges faced by the customers, at the same time, what are the challenges faced by the organizations, and how the AI powered contact center solution can enhance and solve those challenges faced by the customers. We will also discuss about the future trends and evolving needs of the contact center solution and the HMOs. So stay tuned till the end to learn more about the AI powered contact center solution. So to begin with, I would like to introduce our industry experts. We have Dr. Kenechukwu. He is the management executive at Clearline HMO. He is bringing with a wonderful and great experience on the table. He is graduate from the Ghana University, and he brings a wealth of expertise from his management role at the Clearline HMO. He has worked in different departments. He worked in the IT department, and he is from the pharmacy as well. So this is the unique blend of healthcare knowledge and tech savviness drives innovation and success in his role. So Dr. Kenechukwu, welcome to our webinar. We have Mr. Adeyinka. He is the CEO of Avetium Consult Ltd. Avetium is one of the premium partner of HoduSoft in Nigeria, and Adeyinka has a great experience of overall IT industry and call and contact center solution, the PBX solution in Nigeria. He is bringing a really change to the industry and change into the market. So I highly appreciate that and welcome Mr. Adeyinka for the webinar.
Thank you.
Okay, so you all will be wondering, okay, we are discussing about the healthcare plans, what are the different healthcare plans and how healthcare plans are going to affect our day-to-day life. So basically, we have different type of healthcare plan, healthcare insurance plan. So we have basically mainly two types of healthcare plans, that is HMO and PPO, that is the health maintenance organization and preferred provider organization. So each and every plan has their positives and negatives. So we will be discussing about the HMO plans, that is the health maintenance organization. So health maintenance organization is a type of health insurance plan that provides healthcare services through a network of doctors, hospitals, and other healthcare providers. This plan is mainly focusing on the preventive care and cost effective treatment that encourage patients to seek care within the network of providers. So we will be discussing first the characteristics of the HMOs. Like, okay, what are the different characteristics that HMO is bringing on the table? Because we all will be having our own personal plan, as well as you all are working in the same industry. So you would be knowing about this basic things that brings on the table. That is the network-based care. So in the HMO, the members, everyone must choose a primary care physicians and get referrals for specialists. So when anyone is not feeling well and when they want to check up their regular things, they first go to the primary care physician and then they give the referrals for the specialist. So this is encouraging that care is coordinated and cost effective. So at the same time, for any plans, the most important thing is the cost management, because at the end of the day, money matters. So HMO often have lower premiums and out of pocket cost. This makes the healthcare more affordable for each and every member. So the preventive focus is, this entire plan is prioritizing the preventive care and a wellness care. This emphasizes on preventive healthcare in such a way that they focus more on the regular checkup, vaccination, and screening. And this reduces the need for a costly treatment in the future. Okay, let's discuss some of the importance of HMO in the healthcare industry. So as we discussed in the previous slide, this is a coordinated care they provide in the HMO. So this requires members to work with the primary care physicians. And once HMO ensures that patients receive coordinated and consistent care, which can lead to better health outcomes. And the next is the access to care. This is a structured healthcare environment when patients can access necessary services without the financial burden. Cost efficiency, we already discussed, because this is something very important, and the HMOs has a high quality of care. At the same time, the premium is very low, and the out of pocket cost is also very low, because this provides a fixed monthly or the annual premiums that are lower than traditional and the formal plans of health insurance plans. And this plan tends to come with low or no deductible. That is the wonderful things for the all the members. And the co-pays are also generally very low. So we both understood about the different plans of the healthcare industry, what are the types of plans they provide, and what is the HMO health maintenance organization. See, we all will be wondering, okay, what is the purpose of the webinar? Because we all are from the different industries. But that is one thing that all binds us together is the contact center solution, because any industry you go in, there is a customer, and when the customer is connecting with any organization, the main and very important aspect for anyone is a contact center solutions. So even in the HMO industry, there are challenges that are faced by HMOs, there are challenges that is faced by the customers. So in today's session, we will be discussing about this different aspects, the key challenges faced by HMO customers. So now I request our industry expert, Dr. Kenechukwu, to please shed some light on the key challenges faced by HMO customers.
Thank you so much. My name is Dr. Chukwuka Kenechukwu. Good morning, guys. I'm greeting you from Nigeria. Good morning, everyone, wherever you are greeting from. I have spent about 6 to 7 years in the health sector as a customer, as a provider, and now I'm in the health insurance industry. So I'll be taking you guys through the challenges faced by HMO customers. So just very quick, I'll run through this. We have the long wait time for customer support. So I'll be giving a bit of some scenarios and stories just to carry you guys along. So I will put myself as a customer. I get to the hospital. I don't know how many of you are from Nigeria, but you would agree with me that there is a syndrome we call JAPA, where the amount of health professionals we have has reduced because most of us have traveled outside the country to look for better means. Now you get to the hospital, you are faced with about 500 patients to see one doctor. And then when you get to your turn, for some reason you want to contact your health insurance and you're trying to call, and because there is a queue, there is a long amount of people that are going to see the same doctor, you are going to be placed on a queue. This most times affects people's psychology because you went there to get better health, or you must have taken maybe your colleague or your family member there. And so if you've ever been in a situation where your family member is ill or sick, you will understand with me that long wait times are not the things you want to hear. You just want your either your health to be better or you want your family's health to be better. We have difficulty in appointment scheduling. Yes, like I said earlier, the amount of medical personnel we have in this country has reduced. So I'm going to use Nigeria as a source because that's where I'm from and that's where I'm working from. Now, difficulties in appointment scheduling. So the amount of doctors we have compared to the amount of enrollees. So when I say enrollees, I'm talking about patients, I'm talking about customers. The ratio is about 1 to 1,000. And so with this, scheduling an appointment will be very difficult because there's only one person, and that one person can be in different facilities and on different days. And this is a time whereby you go to work Monday to Friday, and so you only have times weekends. And even if you go weekends, you are probably on a very long queue. Now we have missed appointment or no show. So this could be from a ton of things. It could be traffic. It could be the same reason I gave earlier from JAPA. It could even be the internet. We have complicated referral processes. So we have referral centers at the dental centers, the optical centers, the diagnostic centers. Again, there is always a gap between the number of primary health centers and referral centers. There are not a lot of referral centers that are spread across the country. So with this has made the referral scheme very difficult because you could be in, for instance, I'm in Lagos. I'm in Obanikoro, that's a place in Lagos. You could be in Lagos, and the next or closest referral center to you could be somewhere in Ikoyi. And I'm sure those from Nigeria agree with me that is a very far distance, especially for this economy that we are in. So we have lack of personalized service. So if you remember earlier, I mentioned that because of the high rates of the JAPA syndrome, allow me to keep using that word, you are not really going to get a personalized service. What you will meet at the hospitals these days are doctors trying to rush your case notes just for them to meet up with the amount of load on the queue in the hospitals. We have challenges in understanding benefits and coverage. So yeah, this is a very key point in our industry today, in the sense that most HMOs are trying, there's this trick they do when they know that you do not have a lot of medical experience. So what they do is they hide medical limits within another because they know you don't understand. Hopefully, when you see it, you will be convinced that, oh yes, this is the right plan for me. And you probably will not know of that hidden clause until it is time for you to use that medical services. So one of the things I normally preach to people is when you want to buy a plan, you get an RM, they should explain to you line by line, detail by details of everything you are covered for and what you're not covered for. Next slide. Right, we have communication gaps with providers. So the providers here, we call hospitals providers in the health insurance space. Now, communication gap could be from a ton of things, especially in our economy. One of the key things is our network downtimes. And this year alone, I can't count how many times we've had severe network downtimes. There was a time currently we had what's this thing called? One of our main lines were cut short from the rivers. That caused a serious downtime across the whole country. So this point I can't even overemphasize. There is a gap currently in the communication scheme between the providers, between the customers, and the HMOs. Handling emergency queries, yes. So handling emergency queries, this issue has been ongoing for a while now. And a key reason why this issue persists is also due to the fact that there are not a lot of medical or the experienced people have left us. So you go to the hospital and you see somebody trying to cover for 2 or 3 or 4 different skills rather than getting the people that went to school to study these specialties. Now, language barrier. In Nigeria today, I'm sure we have over 400 plus languages, and you would agree with me that there are people that, in as much as English is a common language, there are people who are not fluent in English. And so you get this scenario where someone comes to the hospital really sick, and you're trying to understand what the person is saying, but you cannot, because the person can only speak his or her native language. Difficulty in managing chronic conditions. So chronic conditions are conditions such as hypertension, diabetes, asthma, arthritis. These are conditions that are most times are for a long time and do not have really any cure per se. So what you do is you manage them, and hopefully once you keep there are some tests. Once you keep those tests in check, you are able to at least elongate your life. Now, this has become a very huge risk in our part of the world because for some reason we now have a lot of hypertensive people coming up, CVAs, and so many things. Now, most times when you want to purchase a plan, there is always a different price for people that are on chronic medications and the people that are not on chronic medications. And the reason for this is people on chronic, it's almost a key thing to know that you'll be receiving drugs every month, which means there is an estimated cost that's a base cost for you because you'll be receiving drugs every month, unlike those who are not on chronic. So with this, most enrollees tend to hide that they have chronic conditions just so they can beat the system. Inconsistent service across channels. Yes, so this is actually a very key problem in our HMO industry for customers. I will give myself an example. In my past life, when I was in Ghana, I was using this health insurance. So I called someone, I think it was on a Monday, and it was this, I complained about something we are called, and I got a ticket. After 2-3 days, I didn't receive any resolution, so I texted them. Now, when I texted them, I had to go over my complaints from scratch. See, most people would not like this because they would want, I have already complained previously to you via call. So you see the connection between the channels, the call channels, the chat channels, there is very, very small connections in our health insurance industry these days. So now I'll be taking you guys through patient experience and satisfaction statistics in healthcare. A survey conducted by Accenture found out that about 2/3 of healthcare customers have had negative experiences with. Yes. So this is actually a common thing in our part of the world. I don't know about everywhere, but if you meet everybody on the street today, they will tell you that they have just one hospital they go to. And that hospital, they have been going to that hospital since their forefathers or their great-great-grandfathers. And by the time you dig deep to know why they chose that hospital, it's mostly because maybe the hospital they were using before disappointed them. And so you see a ton of people coming with, oh, this hospital have been there before, I don't like their experience. And the moment they get just one good experience from one hospital, that's the hospital for them. So almost everybody has had 1 or 2 negative experience with a provider. Patient Pop reports that 57% of patients expect automated notifications via text, voice, or email to remind them to schedule appointments or take medications. 70% of patients say they will choose providers based on whether they send emails or text messages reminders for preventive or follow-up care. Yes, so this is actually a very key point. In my little time on this earth, I know that I would like to be reminded for certain things, especially things that are concerning my health. So, one of the things I know most health insurance people are doing is when you get to the hospital and the hospital sends a code or request for a code for you, you get a notification in your SMS saying, "Dear so and so, this hospital has requested for this procedure, this procedure, this procedure." Most enrollees want to be carried along with their health plans whenever they go to the hospital. According to Solution Reach, 60% of patients aren't willing to hold for more than a minute. Just 32% will call back. Yes, so if you remember when I was saying, if you've ever been in a situation where you have a loved one that is very sick, telling me to wait for 1 minute is almost very irritating because all I just want is for my loved one to get better.
Thank you very much, Dr. Kenechukwu. I highly appreciate that you are bringing a very good experience for all our attendees, and thank you very much for discussing what are the challenges faced by the HMO customers. So I would now want my attendees and all the viewers to please give your valuable feedbacks that what do you think is the biggest challenge faced by HMOs today? Because this is something we all would have experienced, because if you are in the same industry, you would have definitely faced this. And if as a patient, you also would have faced this. So please let me know whether it is the managing patient inquiries efficiently, or reducing operational cost, or integrating communication channels, or improving patient satisfaction. So please let me know what do you think is the biggest challenge faced by HMOs today. Okay, we have one answer from India that says integrating communication channel is the biggest challenge faced by HMOs today. I request all other attendees and viewers to please give your valuable insights. Okay, people join from LinkedIn and YouTube. They can comment over there and give their feedbacks. Okay, we have a response from Dr. Kandwal, and he thinks the managing patient inquiries efficiently is the key challenge faced by HMOs. Okay, we have more answers about integrating communication channels or managing patient inquiries. Okay, we have one more answer from Ahmed that says the managing patient inquiries efficiently is the biggest challenge. Okay, we have an answer from Rasha, and she says that managing patient inquiries is the biggest challenge. Jeremiah, also from Nigeria, says the managing patient inquiries is the biggest challenge. Okay, we have a really good response from all our attendees. Zainab also thinks that managing patient inquiries is the biggest challenge. So we have got multiple answers, and the managing patient inquiries is the biggest challenge all the HMOs are facing today. So now I request, like, because all our attendees has given their valuable feedbacks that what they think is the biggest challenge faced by the HMOs today. And now I request our industry expert to please shed some more lights on the key challenges faced by HMOs today.
All right, I've seen a lot of responses. All of you are all very, very correct. Very, very correct. I'll be taking you through the challenges faced by us. Let me use us, HMOs, because I just took you through the challenges faced by the customers. Now it's time for you to know our challenges. The first here is reducing operational costs while improving service quality. Yes, so you would agree with me that we're trying to improve our service quality. We would need tools, we would need personnel, and these things do not come for free. They are cost hand in hand. So in order to, one of the key challenges you will see most HMOs face is they are trying to cut one or the other. So it means they want to improve service but at a cheaper cost, which most times do not tally. Maintaining compliance with healthcare regulations. Yes. So in Nigeria, we have our regulator is called NHIA, Nigeria National Health Insurance Authority. That's just for the whole country. And in the states where you operate, you have another regulator. In Lagos, I think they're called LASHMA. Now, the problem with maintaining compliance is you have policies from NHIA that are way different from policies that are set within the state. Most times there is a conflict. And in trying to comply, you are most likely going to either fault one of the laws. And this usually causes problems with health insurances. Inefficiency and time consuming work. Yes, so there are a lot of repetitive functions in health insurance. As a customer, you go to the hospital, they check if you're eligible. If you are, they take you to see a doctor. Once you're done, they prescribe medications for you. So there are a lot of, because these things are repetitive every day. If you do not have the right personnel, especially from our end, which is, when I say our end, I mean the health insurance, there tend to be loopholes and errors within these very simple repetitive functions. Managing high call volumes and patient inquiries. Yes. If you remember when I was talking about the customer side, I told you that there is almost a ratio of 500 to 1,000 customers to one doctor. And this is the situation where you are seeing, because of that ratio, and at a time you're receiving calls from 10, 15, 20, 30 people at a time complaining about the same thing from the same hospital. And now, because of this, the first point, which was earlier stated, reducing operational cost, in order to mitigate this, you would either have to employ a whole lot of people to meet everyone's needs, or you have to enter into AI or tech. Lack of core recording capability. Now, in the health insurance space, most times, all times, when we sign contracts, we have this confidentiality scheme, which is that we keep your information safe. Now, there are situations where you consult a doctor. There's an ongoing tech thing called telemedicine. I don't know if you've heard about it. You consult a doctor via call, and the doctor prescribes some medications for you. Now, if there is no call recording capability and you get to the pharmacy gives you a different drug, there is no way for us to go back and check that, okay, what were you actually prescribed and what were you actually given? Most HMOs lack this tech feature, which is really causing a lot of issues. Integrating multiple communication channels. Yes, I cannot emphasize how this is a very key problem, because in our country today, you can agree with me that there are a lot of channels coming up, from chats. I can't tell you how many types of chat there are, to calls, to emails, to video calls and everything. So a lot of people do not like to repeat themselves, because it gives this awareness that you're not listening to me, you do not care about my well-being. Tracking and managing business activities efficiently. Yes. So if you remember when I first mentioned inefficiency and time consuming work, the lack of tech, the health insurance scheme now is going towards tech and less human, because there's a lot of repetitive functions. And you see, if you agree with me that once humans are always involved, there is the thing they call human factor, human error, which will be reduced if you could get tech to track most of these little repetitive functions.
Thank you very much, Dr. Kenechukwu, for discussing about the key challenging faced by HMOs. Now, all our attendees would be curious to know, okay, now we know what are the challenges faced by HMO customers, and now we also know what are the challenges faced by HMOs. This is very important for all of us to know that how this AI-powered contact center solution would mitigate these challenges and help us to improvise the customer experience. So now I request our industry expert, Mr. Adeyinka, to please give your valuable insights on the role of AI-powered contact center solutions.
All right. Thank you very much, Vasant, and morning to everybody, and good afternoon to the rest of the people from all the parts of the world. It's a great opportunity to be speaking to everybody on a very important aspect of our life, which is about health. There's a saying in this part of the world that says health is wealth. And so if we're not talking about health, I don't know what else we should be talking about. I lead the team in Avetium Consult in Nigeria, where we support our customers across all verticals, from a customer support perspective and also from some other IT related issues. So, but today, because we are focusing on health sector, I'll just be talking to you about some issues that I feel can improve and change these narratives in the health sector. Omnichannel communication for seamless patient interaction is something that is very important because we're in the age where customers are talking to us from different channels, both the voice and the non-voice channels. And studies have shown that the increase in the non-voice channel is growing. So we are in an age where one of the ways by which you can talk to customers in a seamless way is to make sure that you have a solution that is able to manage all this interaction across all channels and then be able to give you visibility, not just managing it. So, and what AI does for you is that it has some predefined answers that can give all these patients, because a whole lot of repetitive things are things that happen at the end of the day. There are certain basic things that no matter who you are, they need to just take you through those processes before you are attended to. And that's where AI comes in to reduce the time you're likely to spend on those things. And that's where you need automated workflows, because hospitals may also be different from hospitals. HMOs may have different internal processes for different types of things. So the system, the AI has the ability to make sure that you have automated workflows and even DIY. So people are willing to do a lot of things by themselves, especially when they know that they will be able to, that will be able to make them faster as well. And all these actions that are happening to give you ability to have real-time intelligence that are happening across all these channels, across all these touch points. And then you're able to analyze them and make changes. You're able to analyze them to even make improvements. So there can be real-time intervention. So you can see from your dashboard how many customers are waiting in different places. I mean, what are they waiting for? Why? What is causing the delay? What happened last week? What happened yesterday? And these are intelligence that you need in order for you to adjust your processes so that the customer experience at all these touch points and at the hospitals can be improved as well. We've had a situation whereby HMOs or hospitals have their own existing applications, and then there's need for all these applications to talk to each other so that applications don't act in silos. They don't act independent of each other, because there is need for all of them to be connected to each other so that this thinking, this intelligence that is coming from all these applications can look like a connected thinking. And then that is when it makes sense to the organization, so that you can see the life cycle, the journey that the patient takes from the time it's interacting with you to the time the patient leaves. So all these things are things that are very, very important that AI will be able to do for you from time to time. I think Dr. Ken will also like to speak to one or two of all these other things as well. So, I mean, when you look at the smooth management of the HMO and the outpatient department is very, very important, because, I mean, most of the time in the health environment, you always have to come back. There are seasonal things. When flu comes, you will have to come. When some other things, and it's just the nature that we find ourselves. So there's nothing you can do about that, but to make sure that there is a smooth experience, there's a good experience that you have every time you need to interact with your hospital. In terms of the toll-free number, so it's important that in as much as the non-voice channels are very important in terms of email, in terms of chat, in terms of maybe through the social media or WhatsApp, so that you can get some instant messaging support. The ability for you to have a place where you can call and express yourself and you can be heard is very important. And that's why a lot of organizations have even the ambulance services on toll-free line, so that not having credit or airtime on your call is not going to be an issue. And then the other thing that is very important, because we all work um, in a very busy environment, ability for you to be able to schedule appointment that you're going to have with doctors, with hospitals, with HMOs in a way that it fits into your time schedule is very, very important. And it's not something that you can just do and put in an Excel sheet and save somewhere, and then something happens to it and then it crashes and you can't reach it again. And that's why ability to do all this scheduling via the IVR or chatbot is something that is very, very important, so that everybody can see, not just one person. The moment is there, it's visible to everybody in the organization, and then it's also visible to you that you have been scheduled, and then you can manage it from your phone, from your devices. You have prompts, you have things reminding you from time to time, and it's not manual intervention. And so these are all the things that are very, very important for you. And the concern at times in this environment, especially with the global economic crisis that are going on, is the fact that, I mean, is this going to cost an arm and a leg? Okay, what if I want to start small and take the baby steps and move forward? And that's where the scalability and automation comes in. So it's a scalable thing. You can start little and grow with your customer base and grow with the complexity of your operations as well. And then you put in a whole lot of automation that your staff can also catch up with, so that it's not too overwhelming for them. And you can have this integrated with your hospital management applications. You can have it with your enterprise resource application that you have that is managing all these things, so that you are able to also account for all the interactions and all your customer experience. We are getting to a stage where customer experience is almost in the future going to be a balance sheet item for organizations, because this is going to count for them as well. So those are the kind of things that we need to be looking at in the HMO industry.
Thank you. Thank you very much, Mr. Adeyinka, for your valuable insights on the role of AI-powered contact center solution. I am sure that all my attendees are definitely from the same industry, and they would have definitely agree with you. So now it's a time for a little bit of exercise for all the attendees, and it's really important for me to know your valuable feedbacks. So just want to know, what features do you think for a contact center solution would most benefit your organization? Because whether we are from the healthcare industry, for any industry, we all are working with the contact center solution. So please share your valuable insights, whether it's a omni-channel communication, real-time analytics and reporting, automated workflows, or integrating with existing systems. Because even in the healthcare, we have the HMS solutions that you all would be using, or even in banking, we have the banking applications. So please share your valuable feedback on the contact center solution most benefit. And if anyone thinks that there is something which is not covered in this options, and you think there is another option which is the most benefit for your organization for the omni-channel contact center solution, please let us know. Okay. We have a response from India. They think the omni-channel communication is the most used feature by them. Okay. All the attendees who has joined from YouTube and LinkedIn can please share their valuable insights. Okay, we have another responses which says the omni-channel communication would be the most beneficial, as well as the automated workflows would be the most beneficial solution for them. Okay, we have response from Bitrise and Anisha. They think the omni-channel communication is the most beneficial feature for their contact center solution. Okay, we had some of the joint attendees from Egypt, from Lebanon. I would like to know their feedbacks as well on this question. Okay, thank you very much, everyone, for their valuable insights. So, as Adeyinka has rightly mentioned, and as you all responded, that omni-channel communication and automated workflows in the contact center solution is the most beneficial for them. Okay, now you know that we discussed about HMOs, we discussed about their challenges, we discussed about the AI power contact center solution, but we also would like to know that how we can implement those solutions in our organization. So we have a HoduCC omnichannel CX suite that many of our clients are already using in the healthcare and the HMOs. So there are some basic benefits that they get through the HMOs, because now, you know, if we talk about any call center solution or a contact center solution, that has become a multi-purpose solution, and that brings a single number for the social media channels. Even like that ensures that better management of customer queries, and that brings an excellent feature of APIs, because in healthcare industry we use the health management solution, and that integration with the third party application is also very vital for them. And all of our customers would agree that after using the HoduCC solution, their operations are really streamlined and the cost has been reduced drastically. As we discussed earlier, the existing healthcare systems that they are using, we have integrated our solution with their healthcare system, and that brings a seamless experience for them. Also, compliance with the healthcare regulations, and the most important thing in the industry is the data management and patient follow-up. So, with our solution, they were able to manage the data in a better way, and patient follow-up was also being done wonderfully. Okay. So now I request Dr. Kenechukwu to please share his experience about the Hudu CC and what are the challenges he faced earlier, and how the solution brings help in them to have a better outcome.
Thank you so much. So, if you remember my journey, I've spoken to you as a customer, I've spoken to you as HMO. Now, I'm going to speak to you as one of the customers of HoduSoft. Now, before we encountered HoduSoft, I'm just going to give a brief story. So I won't take much time. We were using an on-premise call center solution. One of my key problems with the on-premise call center solution was data, because as you agree with me that the parts of the world we are going into, data is very key. You use data to make decisions of whether or not to do this or to do that. One of the other problems I encountered very much was transfer of information. So we run shifts where we are, and so the night shift is done, and there are issues on the night shift that maybe one or two customers called. And so those same customers might call on the day shift, and you see, they have to start all over again explaining. One of the things that HoduSoft did for us was to give us a CRM, which was a very key thing in our operations. So you could call today, and once you're done, we input your problems, you get a ticket. If you should call again, if a different agent should get that call, they already can see what your previous issues were and which of them has been fixed. So they could already tell that, okay, this is why this person is calling. You see, it makes attending to our customers faster. You don't have to come again and discuss all your problems from scratch. Let me just go through what's on the slide. Initial adjustment to the new system. Yes, so this is one of our challenges, because like I told you, we're coming from on-site premise software, which was built almost 10 years ago. Although with these issues, they came through and they gave us training. One of the things I also appreciate them for is they know that our peak times are during the day. So they were willing to work with us and transition our system at night, where we will not have any downtimes. Now, securing data migration during the transition, just like I said, one of the other reasons why we moved to HoduSoft was we were hacked twice. As you can agree with me, on-site servers are not very, very safe. There are a lot of people trying to hack and trying to get data. So, but since we moved to HoduSoft, which they are now handling our cloud information, we haven't had one case of hacking. And one of the things this does for us is we don't have to employ anyone to take care of our cloud solution. They handle everything into it. Adjusting to the new system and overcoming staff concerns. Like I said, this is one of the key things that they did for us. When we earlier first started with them, there were some, because we were moving from a different system, they gave us a relationship manager to take us through. And so there was almost a, whenever you have any issues, you call, they would come over, take you through the system one by one. Even currently, when we employ new staffs, they are always ready to come and take the new staff through the new systems. All right. So since we started using HoduSoft, we have had a 40% increase in agent productivity. So if you remember when I said one of the key things we were struggling was with the CRM. So someone calls this and the next time they're calling, they're starting all over again. So this increases our average response time and our average resolution time. But with HoduSoft, because I already know why you are calling, even as you are calling, I know who is calling because we've been able to integrate HoduSoft to our own HMO system, whereby when you call, I know who is calling. So when you call, imagine just you calling your HMO and before you could even speak, they call your name. Hello, Mrs. This, hello, Mrs. That. Thank you for, you see, it gives that assurance that yes, these people know me. They know why I'm calling. And so it makes handling issues faster, which also are provided for us. We have a 50% boost in operational efficiency. Yes. So the data we got from HoduSoft, data we still get from HoduSoft has helped us in deciding the right size of agents we need for shifts and for days. I can't express how important this actually helped us because previously we were just pulling people, just trying to get as many people to handle different channels. But when we moved to HoduSoft, one of the key things they helped us with was with data. We were able to use data to say, oh, on these days we have very few amount of employees going to the hospital. So because of this, we can push the amount of agents required for just that day to give optimal and the best service. Enhanced data security, yes. So I cannot emphasize this again. One of the things, like I said, one of the key reasons I started the CRM why we moved was because we've been hacked twice. And you would agree with me that data is very key in where we are. You do not want your information to be outside. So when we heard of HoduSoft and they came through, they gave us a robust system, a cloud system to store our data. This was something I'm sure anyone would jump on.
I'm delighted to know, Dr. Kenechukwu, that you are having an amazing experience with HoduCC solution. And all our attendees who has joined from Nigeria and other parts of the world would love the same experience as you have. But people who has joined from the parts of the world in Nigeria, they would be wondering, okay, we want the same experience as Dr. Kenechukwu have for the contact center solution, but how we can have this experience? So we have the right person to share some more insights on that. Mr. Adeyinka is one of the premium partner of HoduSoft in Nigeria, so he can give us more insights on the same.
All right, thanks. I think it's important that we understand that in as much as we are partner to HoduSoft, we also position ourselves as partners to our clients. The whole idea is that we want to empower you to grow your business because without seeing you as a partner, we are not technology hawkers. We're not hawking solutions and just dropping it and run away and then you figure it out. That's not what we do. And I'm happy and I'm quite excited that Dr. Kenechukwu made credence to that as well, that we work with our customers along the line so to make sure that you get value for the money you're paying. And then if you're not in business, we are not in business as well. And that's why when we want to set up solution for you, we have frequent engagements. We hold what we call discovery session with you to make sure that we understand your pain points. We share in your value in what you're trying to achieve as an organization. And we understand your existing processes. We figure it out, we sketch it out, we try to get the architecture of it, and we make sure that you align and you agree with it. have internal discussion with your stakeholders so that everybody buys into this solution. And it is that same solution or that same process that we use the system to automate for you so that your customers can have a very good experience. So we start from need analysis, understanding what you want, the various handshakes, and the purpose for it. At times, you go into those sessions with organizations and they realize that maybe there's no need. There are ways by which you can cut short all those experiences and everything. And that's what we do. And we customize the solution to you alone so that when you have the solution, it distinguishes you in the market. It distinguishes you among the other organizations that are competing with you so that your distinct customer experience can be unique to you as an organization alone. And then we go into the deployment and the setup of the solution. And we have various standardization that we go through. We first of all make sure that we do what we call an IAT, which is an internal acceptance test. And then we move to the user acceptance test, where the customer itself participates in that test to be sure that what we have promised that we're going to deliver is what we are delivering. And then we go into the implementation, and then the implementation can be done in different ways, either the parallel method, where you run the two systems together, and then before you shut down one, or we go fully into the cutover. And then when we cut you over, we go through an handholding session for as many months as possible. Our handholding session can be very rigorous. At times, it can be very disturbing because we want to be sure that there are no teething problems, and the teething problems that may arise are being resolved almost immediately. So we go in this journey with our clients, and then we make sure that from time to time, we do the training and knowledge transfer. One thing that we try to do for our customers is we make sure we empower them, because we look at it that the difference between the customers, the difference between what you are doing and what we are doing is the same thing. It's the same thing that, we know we have a knowledge, and you have the knowledge as well. And we can transfer this knowledge to you so that, you can also be able to do some things by yourself. And we understand that your business at times needs immediate intervention. So we don't want you to rely on us on things that you can do yourself. We are available 24/7, but at the same time, we want to empower you so that you can be in charge yourself as well. And then we give you the post-development maintenance and support, resolve any technical issues, whether weekends, whether public holiday, we are there for you. And one other thing that we do is that we give you a turnkey solution whereby we make sure that all the multiple customers or service providers at the end, we take care of them for you. So you are just talking to us. We take full responsibility of all the things that are meant to work, from the telephony to the hosting to the software and everything. We are just the only one that you are talking to. So we take over your pains. We just want you to focus on your core business, which is to make customers happy. And that's what we do from the back end point of view. So in terms of the future trends and the evolving needs in HMO industry, there are so many things that, from our own expectation, are things that are going to shape the future of the HMOs, of the healthcare. We're beginning to see that even surgery are now being performed through video calls. A whole lot of telemedicine is becoming more popular because everybody is, especially people that are living in cosmopolitan environments, you're not feeling good, and you want things to be done for you. You don't want to spend 2 hours in the traffic before you get to where you're going, whereas what it can be done for you. So even in my own hospital that I use, every appointment, they ask me, do I want it virtual or do I want it to come physical? So things have changed. So there are going to be increase in the demand for seamless communication, which is very, very important. And when we talk about communication here, we are talking about system-driven communication, technology-driven communication that are going to aid the communication. You can imagine the number of people that are talking together, sharing knowledge this morning across different countries, across different continents this morning. And that's the situation that we're going to find ourselves. And so it means that omnichannel is going to be very, very important, because you can't have communication with different customers just through one channel. It's going to be multiple channels. It's going to be voice and non-voice channel. And then it's important for you to make sure that all these channel interactions are efficient. And one of the ways for you to make it efficient is to put in a lot of automation to make it AI driven, so that a whole lot of things that are not necessary or that the machine can do for you are being done for you. So that by the time you are speaking, you can imagine everybody knows that when you go to an hospital, they need to ask for your name, they need to ask for your age, they need to ask for so many things. So the AI is going to do all that for you, so that by the time you are engaging the customer, you can see all the things that AI has done for you, and it reduces the time that you're going to engage. And before you know it, speed is gained. And then you're able to also personalize that. So you're not just talking to a patient just as a patient, but you're able to personalize all the things that you're going to be doing in that space. I think when you look at about the enhanced remote care support as well, just like I said, remote care support is something that is going to now happen. Distance is not going to be a barrier again. We're talking about telemedicine already, where people that are in far distance place are now being diagnosed even across. And this is also helpful in situation whereby there are specialists, there are consultants that are in a far place, and you have some other people that are different consultants, and they are using systems to do operation. And that's where you need security and compliance, because confidentiality and data security is something that is very, very important in the health sector, because there has to be patient confidentiality. If there is no confidentiality, nobody is going to want to come to talk to you, because whatever anybody is going through is personal to that person, and you want that person to feel comfortable with you, that it can divulge and it can feel free. So data security is something that is very important, and that's why you realize that Avetium Consult, we have data protection certified. We are global data protection also compliant as an organization, and this reflects in all our processes, in all our systems, and security is something that is very, very important to us. And one thing that HMOs and medical organizations all over the world need to take very seriously is the analytics and reporting. A whole lot of things that are coming to them as a surprise are things that are already sitting with them through data. But unfortunately, if you don't have the data that is speaking to you, if you don't have intelligence that is able to give you all this information at real time, then before you respond, you'll just be catching up with issues instead of you to be ahead of issues. So you'll be catching up with issues, and that's not what you want to do. So you need real-time analytics and reporting to speak to you in a periodic manner for you to analyze and for you to be able to use to make interventions, for you to be able to use to turn around and turn a lot of things around. And just like I said earlier on, that scalability is very important. You must be able to take the baby steps first and then move with time. And then these days, everybody looks at making sure that things are in the cloud. Nobody wants to leave their power running because of one little server that you have that must not be shut down. So a lot of people are adopting cloud. Let's transfer most of this problem to the data centers so that they can take care of all our problems. They make sure they guarantee our service level. They make sure their availability is on point, and they make sure that they are reachable at all times. So we're getting to the situation whereby everybody just needs to focus on their core business. The core business of HMOs is to give very good experience to the patients that are coming. Core experience of the hospital, give experience, make them better, make them livelier, and then let's just take care of the technology needs that's going to enhance and enable this for you.
Okay, thank you very much, Mr. Adeyinka, for giving valuable insights about the future trends and the evolving needs of the HMOs. All of our attendees are from the same industry, and they would definitely agree with you about what are the trends and needs of for them in the HMO industry. At the last, just one quick feedback from all my attendees, because they are in the same industry of the contact center solution. So I would like to know from your side that what percentage of your contact center's budget is allocated to automating HMO related tasks? Because we all know that slowly and gradually things are moving towards AI. So how much efforts and how much budget you are putting towards this automating task is very much important. So please share your valuable insights and feedbacks, whether it's less than 5% or 5 to 10%, 11 to 20, or 21 to 30. Okay, we are receiving response that they feel okay, 11 to 20% of investment on the automating task is important. Okay, we are running out of time, so I request everyone to quickly share their valuable feedbacks. Do you feel is the most important to invest in the automating contact center solution? Okay, we have one of the response from Nigeria that says, okay, 11 to 20% moderate level of investment is good enough for the contact center solutions automating tasks. Okay, 11 to 20% is good enough. Yeah. Okay, thank you very much, everyone. And just going quickly, I'm sure Dr. Kenechukwu and Mr. Adeyinka has enlightened us about the AI in context and AI-powered contact center solution in the healthcare industry. But still, if anyone has any questions, any query, any valuable feedbacks, please type in your comment box about your queries. We would be more than delighted to give you insights about the same. And meanwhile, you type your questions. Let me quickly run you through the about the HoduSoft. So HoduSoft is a unified communication solution expert, and we are working towards making the people's life better and making the customer's experience smooth. So we have Hodu mainly solution, that is Hodu CC Omnichannel CXU and Hodu PBX IPBBX software. In Hodu CC, we have the omni-channel solution, we have advanced dialer, we have skill-based routing, we have automated call distribution, we have speech analytics, we have all the AI powered and features, that is whether you're looking for a voice bot, whether you're looking for a chat bot, whether you're looking for AI chatbot, whatever your customer is trying to connect you through with, any channel your customer is trying to connect you, we have got it covered. In the Hodu PBX, we have advanced reseller module, we have list cost routing, prepaid, postpaid billing, we have payment gateway integration, 5,000 plus concurrent calls you can manage through a single server, and 50,000 plus extension you can manage through a cluster architecture. Okay, these are the accolades HoduSoft has achieved over the years, and this is a continuous achievements that shows the great efforts has done by our technical team. So, by the grace of God and the hard work of all our team members, we have received the Gartner's awards continuously over the years. Also, from the software suggest information technology, these are the achievements HoduSoft has achieved over the past few years. Okay, all my attendees, please just type in your questions while I'm discussing about the HoduSoft solutions. These are our prominent customers across the globe: UNICEF, Airpeace Nigeria, Aizan, Abe Mortgage Bank, Live Pure India, Coronation Insurance, PFD Microfinance Bank in Nigeria, Brother Printers India, and many more are our trusted customers across the globe. So, please, I request everyone to please share their valuable questions. So I'm sure Mr. Adeyinka and Dr. Kenechukwu has enlightened us about the solution, but still, if anyone has any query, any feedback, please let us know. Okay, we have one link here in the comment box. You can click on that link and fill up the form and give their valuable insights. So I hope everyone is very well understood about this solutioning of the AI powered in the contact center solution and the how we can enhance the future of patient experience. So once again, I want to thank all my attendees for their valuable time. And thank you very much, everyone, for joining this webinar. And a special thanks to Dr. Kenechukwu and Mr. Adeyinka for their time and giving their valuable, years of experience sharing in just 1 hour with all our attendees. I highly appreciate and thank you very much once again. And at the last, I would also like to thank our marketing expert on the backstage. They have put one tremendous efforts over last few weeks. You must have heard the name about the Rohit, Kavisha, and Jeremiah from Avetium team. They all had put tremendous efforts to make this webinar a really successful webinar. So once again, thank you very much, everyone, for joining this webinar.
Thank you.
Thank you.